3 years ago, Annabell Downey was told she had breast cancer. Not only that, it had already spread to her shoulder and spine. But she'd been to the doctor time and again.
I went about my back and they kept saying it was old age. And then there was one day I couldn't walk. I'd end up getting rushed in the hospital.
Annabell says she simply wasn't taken seriously, her learning disability making it harder to communicate just how bad the pain could be. And she hadn't considered the breast pain she had could be linked.
People with learning disabilities, they can't explain themselves properly. And I'm just saying because of myself. And they don't get listened. They keep thinking that they're crying wolf.
But Annabell is not alone. A study has revealed that people with learning disabilities are about half as likely to be referred for urgent investigation, despite having red flag symptoms possibly caused by cancer. And by then it's more likely to have spread and become untreatable. In fact, most of those with a severe learning disability or Down syndrome are dying within 4 years of diagnosis, compared to 9 years for those without.
What we found were major disadvantages across the entire cancer care pathway. We found that people with a learning disability were at much higher risk of cancer, particularly at younger ages. They were 70% more likely to get cancer before the age of 50. But despite that higher risk, when they went to see their GPs with symptoms suggestive of cancer, so those red flag symptoms, they were much less likely to be referred on to a specialist.
The findings follow the most comprehensive investigation into the issue ever carried out. A spokesperson for the Department of Health and Social Care said, "It's unacceptable that people with learning disabilities aren't getting the care they need. This government inherited a health system in crisis, and we're working at pace to improve cancer care, including for people with learning disabilities. We're already seeing progress, with 193,000 more patients having cancer diagnosed or ruled out on time since last year." Annabell's cancer is being kept in check with chemo, but she's no longer able to work and relies on 24/7 care at home. What's so hard is she knows if someone had listened, the outcome might have been so different.
Keep voicing your opinion and say, look, I need something done.
Emma Birchley, Sky News.